discussed the trend that we were continuing to watch, that there has been an increase in COVID-19 cases, particularly among younger people across the state of North Carolina. That trend has continued with lower positivity rates for those age 65 and older and higher rates for those 25 to 44 years of age. And our data mirrors that. So we've seen an increase in our inpatient census over the last 2 weeks, but we're able to handle that volume currently, but the number of patients is skewing younger. We think multiple factors are contributing to that. Certainly more of our older population has been vaccinated because they were offered vaccine first. We also seen more contagious variants in the United States and maybe contributing to more community spread here in North Carolina. So again, underscores the need to get vaccine, get it into people's arms. We have to continue masking, social distancing, and hand washing. COVID-19 is still here. It's still spreading in our communities. So it's easy to get relaxed and want to move on, but we're not out of the woods just yet. On the variant issue, B.1.351 from South Africa is of concern. You may have seen some data that came out of Israel that in the rare instances that people who were vaccinated got COVID, you were more likely to have had that variant in Israel than the non-variant form, suggesting that even people vaccinated could still get that variant. Now, those numbers were very, very small and their clinical disease was mild, but that's the whole crux of the issue about whether someone's going to need a booster. So the companies that make the vaccines are already working on adjustments to the formula of the vaccine in anticipation for the potential for having to have a booster year to year. As to what will trigger that decision, I think part of it is understanding how long immunity is going to last. So if we find that immunity is lasting 6 months, a year, or 2 years, and numbers remain low, it's more likely that a booster won't come every year. But if we're seeing, increases in numbers and individuals that are vaccinated who then are still getting infected with other variants, then I think that's going to change the equation. And then how well they can target a booster to a particular variant. So we see this with influenza vaccine every single year, right? Where a group of experts has to think about what flu virus is circulating in other parts of the world, what do we anticipate is coming, and then how do we match that to vaccines. So I think it'll be a process somewhat like that. But I think we have a lot to learn before that's known. But thankfully, those companies are starting to already do that research and run those trials. And with mRNA vaccine technologies like Pfizer and Moderna use, the nice thing is that you can ramp up vaccine production very quickly, unlike some other traditional vaccines we have. So that's going to give us the ability to be nimble in how we manufacture vaccine.